5 o'clock. We'll go ahead and get started. I'd like to call the April 8th, 2021 Durham County Board of Health meeting to order. First item, I would like to take this moment to welcome our new member in the pharmacist position, Dr. Jean Ray. Welcome to the Durham County Board of Health. Jean, it's a pleasure to have you with us.
Thank you very much, Eric. It's a pleasure to be with everyone, and I appreciate the opportunity to be part of it.
Outstanding. Thank you, sir. Thank you. We'll go ahead on and move to item 2, discussion and approval of adjustments to the agenda. Do we hear any adjustments to the agenda that are needed? Hearing none, I'd like to entertain a motion to approve the agenda.
Spence Curtis, so moved.
Second.
Roll call vote, y'all. Gotta let us know who you are, your name, and then your vote.
I'm gonna do it, Mr. Chairman.
Okay, thank you.
Chairman Ireland,
Yes.
Vice Chairman Jackson.
Yes.
I don't think Dr. Miller is here yet. Dr. McDougall. Mr. Curtis.
Yes.
Dr. Braithwaite.
Yes.
Dr. Orto.
Yes.
Mr. Brown.
Yes.
Commissioner Alam. And Dr. Ray.
Yes.
Thank you.
Thank you. The next item is review of the minutes from our prior meeting. Are there any discussions, changes, edits needed to the minutes from our previous meeting? Hearing none, I entertain a motion to approve the minutes.
So moved. It's Rosemary.
Second, Dr. Ordo.
Thank you. It's been moved and I'd like to entertain the roll call vote at this time.
Chairman Ireland,
Yes.
Vice Chair Jackson,
Yes.
Dr. Miller, Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Dr. Ray.
Yes.
Thank you all. The minutes are approved from our previous meeting. Item 4 on the agenda, any public comments?
No, sir.
Thank you. Item number 5, any staff or program recognitions, Mr. Jenkins?
Chair, if I may, just 3 items for your consideration. I'd like to start off by again saying good evening to the Board of Health, the best Board of Health on this side of heaven. And I'd like to also wish you and staff a happy National Public Health Week. It goes without saying the value that public health brings each and every day, but it's especially gratifying knowing the work that we do in this pandemic moment. So we certainly want to wish you all a happy Public Health Week. I definitely want to recognize the staff for their tireless efforts during this pandemic moment. I'm especially grateful for everyone's collaborative spirit. And I'd also like to let the board know that during this pandemic, I've had the opportunity to really work shoulder to shoulder and elbow to elbow with just about every division. And I don't think that I would truly get that experience if it wasn't for this pandemic that we're in. So from anything from scheduling to registration to me directing traffic in the vaccination clinic, it's truly been an honor to really work alongside with them. And as mentioned with the COVID vaccinations, that continues to go well. And I'm so proud of the staff. We're now at the Health and Human Services Mass Vaccination Clinic. We have the ability to vaccinate on average 500 a day. Particularly days like this are very long because we offer extended hours to those people who work late. And on Thursdays and Fridays, we normally average anywhere from 700 to 800 vaccinations. So staff is really standing tall, doing extremely well. And the third thing that I would like to say is, again, we're just now extremely proud of the staff. The last time that we met, we were in the process of going live on Epic. That's our electronic health record system. And that was in early February when we met. We went live on February 23rd. And so far, so good. To say that we did that in the midst of a pandemic and a very busy time is no easy feat. And I just owe that all to the staff and their dedication and their focus. So again, Mr. Chair, just wanted to really lift up those three things and just give all praise to the wonderful staff that we have. Thank you so much.
Thank you, Mr. Jenkins.
Thank you.
It has been indeed been our pleasure to witness the tireless work and the efforts put forth by you and your staff over this last year and change. Please continue to express to your staff our gratitude, our appreciation, and let them know that they'll always have our continued support. We appreciate everything y'all done for the citizens of Durham County.
Certainly. And it has been a pleasure to see most of you come in for your vaccinations.
Exactly. Very good. Thank you, Rod. Next item is administrative reports, presentations. This will be a presentation on the FY 21-22 proposed budget and fee schedule. Mr. Jenkins.
Thank you, Mr. Chair. At this time, I will yield the floor to our finance administrator, Mr. Will Sutton, who will take you through the FY 21-22 budget and the proposed fee schedule. Will, the floor is yours.
Good afternoon, board members. I have the pleasure and privilege of presenting our FY 21-22 proposed budget to you tonight. And as soon as I get control, I will share my screen. Thank you, Rosalind. Okay, let me get okay. So I first want to start out by saying, well, as you probably know, this was a very rough and very quick budget turnaround that we had to do. This budget was prepared and submitted by February the 12th. And so I must say that even though it was submitted on February the 12th, there were some changes that have taken place after that. And I will go through those changes. But what I did not do was to redo the whole thing over again. I will present what we initially submitted and then go over the changes that have taken place since then. And by all means, if you have a question, feel free to jump in. And if you can't see the screen, I'll try to make it bigger. Just let me know. So on this slide, I always like to start out with a general overview of comparing where we started last year with what was approved versus the number that we're proposing or we're requesting in our budget. And as you can see, a 5% increase, which is not not really huge. And most of that is the personnel costs that normally increase every year. So pretty much you're looking at 5% increase overall for the budget. Again, this is just giving you a high level overview for FY 21 versus FY 22. The next slide kind of focus in on the sources of the budget, where the funds are coming from, where I always like to show how much the county is contributing to our budget and how much funding comes through other external sources like grants, service charges that we collect, Medicaid, insurances, and that's the red portion of the pie. So as you can see, comparing FY 21 to 22, the county's portion that's contributed, there was a small decrease of 1%. And I will say that that small decrease in how much the county contributed is reflective of a couple of new grants that we received. One being the Dental Hope grant, it was $140,000, and one being a grant in health ed, the tobacco prevention grant, that was $126,000. So just overall, I like to give an idea of how much the county is ponying up, so to speak, to our budget versus external funding sources that we don't rely on the county for. On slide number 4, I just give you a breakdown of the personnel versus the operating. I will say that initially, when our budget was submitted back in February, a large portion of the operating increase was attributed to the expansion of Bull City United. Historically, when new staff is brought on to Bull City United, they come in as contract workers. And I guess that's probably the best avenue that they have to just see how the person will work out or be a fit for that particular team. And once they work out as a contract, then they move into a permanent position. So that increase in operating is pretty much all contract services, where the expansion of Bull City United, where they'll come in as a contract worker, and then later on they will be added as a full-time employee. Now, I will say this: what has changed since I submitted this is they have already moved forward with adding the permanent positions in personnel. So if you look at how it's looking right now, those costs will be moved out of contract services line and operating up into personnel. So that's one change that happened after I presented this budget. And of course, later on, I'll get more into those Bull City United numbers.
Will, can I ask a question real quick?
Absolutely.
When Bull City United moves from public health, will their budget move with them?
My understanding is that the budget will move.
Okay.
They will have their own budget separate from public health.
Very good. And the same for Project Build?
Yes.
Okay,
Right,
thank you.
Mr. Chair.
And I was going to mention that later, but that'll be a good segue. I'll get to that later.
Thank you.
No problem. All right, next slide, slide number 5. I go into in some detail for each cost center that makes up the public health budget. Not to get into the weeds too much, but I'll just highlight a couple where there's some, some large differences that kind of jump out at you. So regarding this slide, I'll start with the departmental fund center, where there was an increase. And that was mostly attributed to increases in contracted services that are needed for the department. 6216 health ed, there was an increase. One of the reasons for the increase in health ed is that last fiscal year, there were cuts made to the health ed budget. As a matter of fact, last year, $29,000 was cut in the health ed budget. But it's back this year. So that is one increase for health ed. In addition, there are some new positions that are in health ed that were not there before. For instance, the HIV navigator position, the ACEs coordinator position, and there's a new tobacco prevention manager. All three of those positions are in the FY22 budget, but at the beginning of FY21, they were not in the budget yet. They were added during the year, during this fiscal year. So that was the increase in health. Let's look at 6221 STI, sexually transmitted infections. There's a decrease there. The reason for that decrease is as a result of our medical director. Previously, our medical director was a contract person. And so there was a contract that was set up in the STI fund center. Going forward this year, starting this year and forward, the medical director will be a full-time FTE position. So there will no longer be a contract with that position. There will be a full FTE for that position. And that position is going to reside in the administration budget. Now, as you can see up here in the administration budget, there's not an increase of 200-some thousand because there were some reductions in there that offset that increase or adding that particular position in administration. Okay. Let me look at, well, let's talk about Bull City United. Okay. So when we initially submitted the budget, there was an increase of a little over $1 million. And initially, the increase was for contracted services of $145,000, with the city of Durham funding about $985,000. So they're contributing $985,000 to help cover those costs. But the initial expansion amount was a little over $1 million. So that is the increase in Bull City United. And I do have even more details later on as I get to my notes at the end. Give you a little more detail about that particular expansion in Bull City United. I don't believe anything else. Well, let me talk about the jail health budget. Since we're on here. So we are in the year where we have to
Renegotiate.
we are in the year where we have to go out and
Be contract.
and submit a request for proposal for the company that will contract with us to provide these services for the jail, these medical services. And as of right now, the amount that we have in the budget is just a holding place because we don't know the final number yet. So that's why I just wanted to mention that. I will talk about it a little more in detail later. But again, the jail health budget, we have to send it out for a request for proposal after a certain number of years, every certain number of years the time go by. I think that's the major ones from this particular slide. Again, showing you that overall the expenditure budget was a little over the total expenditure budget, a little over 5.37%.
Yeah. Hey, Will, this is Dr. Jackson.
Yes.
Just a quick question. I couldn't figure out in my head PCM exactly what that is, because I see there's a 20% increase in its budget.
That is pregnancy care management.
Oh, okay.
And a majority of that is reflected from personnel increases. As a matter of fact, I believe, I don't know the percentage, but overall, the retirement percentage increased for the county as well over the last fiscal year.
Okay,
Can't quote that percentage right off the top of my head.
Gotcha.
all right, thanks.
So let's move on to slide 6. We'll get into the revenues. I also like to give a breakdown of the revenues per fund center as well. And I'll go over a couple of highlights. But overall, our revenues increased by 6.9%. So what makes up that increase for the most part? So let's look at admin first. It looks very odd there with whole decrease. So what happened in FY21 is that in discussions with the budget department and along the lines of how county finance wanted to handle things, we started to budget the entire Medicaid cost settlement, 1.5 million, where previously only a portion of Medicaid cost settlement, I believe it was maybe 300,000 of Medicaid cost settlement was budgeted per year throughout the budget. But this FY21 was the first year that the entire Medicaid cost settlement was budgeted. It's about 1.5 million. What the budget department did was to put it all in the admin budget in FY21, the current fiscal year. What FY22 is reflecting is that whole 1.5 million being split to the specific cost centers in which it really belongs to. So that's why you see the large decrease in admin. But that 1.5 million is distributed throughout the budget, specifically in dental, the STI, immunizations, family planning, maternal health. All of those are the fund centers that generate Medicaid revenue. And as a result, they are responsible for, the cost settlement. That is their share of the cost settlement being distributed throughout those. So that explains the big decrease that we see here. Let's see, 6217, the lab, where I think because of my notes are indicating that the Orange County lab testing, there's reduction in Orange County lab testing for the following fiscal year in the amount of that $12,960. As a percent, it's a big, large percent, but as a whole of the budget, it's just a small amount. But since there was a big difference in the decrease, I just wanted to point that out. And what that is that we perform in-house lab services for Orange County. And we send a bill to them for performing those in-house services. So that's pretty much what that represents. Dental, 6218. There's an increase in the revenue budget. That's a couple of things. One, their Medicaid cost settlement is being added, so that's part of it. And in addition, as I mentioned before, dental has a HOPE grant that's new as of this fiscal year that's also added. So they have a new grant and Medicaid cost settlement. Looking at $6,229, I'll talk on that real quick. So in this particular cost center, there was a grant funded position previously, but the funding for that position ran out. And that was at $63,057. But going into FY22, we've requested that the county cover that position. We make it a county funded position since the funds for that grant had ended. And we'll keep that person on staff. They'll be being a grant funded position, there'll be a full-time county funded position. But we'll no longer have that revenue covering the position anymore. So that's why the decrease in the CCI budget. Let me jump to 6244, our on-site a decrease in $60,000. That's a reduction in user fees that are generated from wastewater on site, where previously last fiscal year we budgeted 200,000. This fiscal year we're only budgeting 140,000. And let's see, down in population health, although it's only $2,800, it's a big percentage of that particular budget. But what it represents is the ending of the Duke grant funds for the community health assessment. It was $2,800. So that ended this fiscal year. So we'll not have those grant funds next fiscal year. So again, overall increase 6.96% in the revenue side of our budget. Any questions about the revenues?
Yes, it's Dr. Jackson again. I may have missed it, but did you mention the 66% increase in STI clinic?
Part of it was the Medicaid cost settlement that was originally up in the admin budget. That is one of those. That is one of those cost centers.
One of the two. Okay.
That
Okay.
cost settlement money was distributed to.
All right. Thanks.
Yeah. Slide number 7. And you have to excuse me. I think because I have control, when new people are entering, a window pops up that says admit this person to the meeting.
And can you do that for me, Will?
I
Please?
did. I normally don't see it at first. It takes me a while to recognize that. But
Okay, thank you.
for those that just joined, forgive me, I didn't see you waiting top of the screen. Slide number 7, just get into the new fees that we'll be adding into our budget next fiscal year. I won't go into too much detail. But, the CPT codes that start with the D, they're dental, of course, as you may or may not know. So dental has quite a few new fees that will be established for next fiscal year. And the pharmacy has one. And I wanted to note I had put my little asterisk down here at the bottom. And that is because since the initial budget was submitted, and since we've been working in Epic, getting acclimated to things, after go live, there are a couple of new fees at the bottom down here that have kind of stood out as we transition to that new system that will have to be added also. So even though they weren't listed initially up here in the new section, these will be additional fees that will be added. And we have a meeting next week, I believe, to get into a little more detail regarding these new fees. And there may be even more that come out of that particular meeting. But I just wanted to make sure that I mentioned the new fees as well going forward. So these are the new fees. So next are changes in existing fees. Most of these are for the pharmacy, small changes, but we are required, and if I say this correctly, but we are required to charge the exact cost to us. So when these change, we are required to change them to stay in line with what they are costing us to. And I won't get into a lot of detail with these, but I just listed all the fees out. Next slide, more changes in fees. These are from the lab. As you can see, they're all increases, small amounts, but again, we're required to make these changes.
Well, I do have one question about the medication fees, and you may not be able to answer this, but the one that stood out was the Plan B pill that went up a ton from $3 and something to $20 to $30. Maybe someone else on the call knows.
Right, I cannot answer that. Perhaps maybe Katie, if she is on the line. But if Katie is
all right, I'll ask somebody offline.
I will get an answer for you if Katie is not on the line.
Okay, all right, thanks.
No problem. More sheets. So here are my notes that I really wanted to jump into. You know, for the most part, overall, there wasn't any big major changes, but except for these. So one being the jail health budget. Again, there's a request for proposal that's currently out, and I have an update that I just received that I would like to share. And that update is that the RFP was officially posted for the public on March the 21st. And on March the 30th, a virtual pre-conference was held. I guess it's for the organizations that were interested in that contract to be able to sit in and have a discussion and get some information. And for April the 14th is when those entities have to send any questions that they have back to the purchasing department so that they can get those questions answered. And the final due date for those companies to submit their bid is April the 27th. So I just received that update from the purchasing department. So Bull City United. So getting into the details of the expansion itself. So they're creating 2 teams. And the teams each team consists of 4 violence interrupters and 4 outreach workers. Each team will have 1 supervisor, so that's 2 supervisors. There'll be a data analyst position to support the entire Bull City United program. And as a result of this expansion, they're hiring another manager to kind of distribute the chain, so to speak, so that they won't have a whole team reporting to one manager. But overall, with the increase, we're looking at a 1.9 million expansion for Bull City United. And again, the city will be providing 985,000 of revenue to help offset that 1.9 million expenditure. So again, this is a huge commitment to Bull City United and the work that they do regarding being out in the community and stopping the spread of violence. Next point that I want to make is we have not been asked for any additional reductions and cuts. I'm not saying that the budget department won't come back to us at some point after they've sliced and diced and talked about it and discussed things, but as of yet, we have not been asked to go back into the budget and make any more reductions. Last year, it was kind of a reduction frenzy, but this year it's been kind of quiet so far. They have not come back to us to say, well, we need to reduce our budget another 5% or whatever. So I just want to put that out there. It was a little different last year. They came back to us 2 times for reductions and cuts. The next point that I want to talk about, the COVID-related state grants. So we have been very, very fortunate to receive funding that came through the state for several different COVID-related grants. And normally those grants end on May 31st of each year. But however, we learned that any remaining funding in those COVID grants will be carried over and provided to us again next fiscal year. It is rare that once a grant ends one fiscal year and we don't use all the funds, we are able to receive the unspent funds the next fiscal year. But we already received confirmation from the state that that will happen this fiscal year. So we don't know what the amount is going to be left over yet. So, and we get to the end of the fiscal year and we have X amount of grant funds left. Then in the beginning of the next fiscal year, we have to go through the process of doing an agenda action form to add whatever is left back into the budget. If we knew now, I would have definitely have added it here save a little paperwork time later on.
It will, if I may. I'd also add that just found out today that some of the grants that we received for COVID relief funds will be extended until 2024. And I also received word to the Board of Health that 95 million is coming to North Carolina's public health departments. That's hot off the press, coming from the CDC, and more information will be disseminated later on this week.
Thank you.
Additionally, to your question, Madam Vice Chair, we did find out that the Plan B drug was the price was set by the drug manufacturer. They set the pricing and it changed quarterly based on demand. So definitely it's a fluctuation. So at present, that's the price point that they have.
Wow, thank you. That's too bad.
Mm.
Okay,
Let's hope it goes down.
all right.
That's really high. I agree with you, Rosemary.
Mhm.
So my next bullet point, that was about the Bull City United Project Build moving from public health. In terms of the numbers in the budget, true, as well as they're exploring where staff will physically reside. So that I think they have some ideas that they're working on, but in addition to the numbers being moved from the public health budget, I believe they're exploring actually where the physical staff will be located outside of public health as well. And right, if I'm wrong on that, please correct me.
That's accurate.
And so the last point I want to talk about is we have an opportunity to apply for a 2-year, $4 million grant from the Office of Minority Health. That grant deadline is April the 24th. So we are working very hard to get all the information together to be able to apply for that deadline. And it's not added in the budget numbers yet. This actually came up on our radar not too long ago, but we were working very hard to put all the information together to present to the Office of Minority Health in response to that request. And again, it's a $4 million grant total. It is for 2 years. Oh, excuse me, April 20th is the deadline. April 20th is the deadline. Thank you, Lindsay. So,
Well, I will add, this is a very popular grant that some of you may have heard about. It's garnered a whole lot of attention, particularly coming from a lot of our congressional delegation. Durham thought it not robbery to put our name in a hat, and we're proud to be joined with NC Central, Project Access, Latin 19 Coalition, Healthcare Coalition, and many, many others. As Will has indicated, 2 years, $4 million to promote health literacy around COVID-19. Just want the Board of Health to know that we will be sending you a narrative for you to critique. We hope to get that to you all tomorrow morning, so please be on the lookout. And we are definitely soliciting your feedback. But if we were able to get this, it would certainly be a home run, and we look forward to your feedback. Thank you.
thank you, Rod. And that's pretty much a summary of our budget. Any final questions that you may have, feel free. I'll go back to this slide right here. Kind of shows the overall budget compared to last fiscal year. Any final questions?
No more questions for Will? Thank you, Will. We appreciate you.
Thank you, and I will turn the controls back over to Rosalind.
At this time, I'll entertain a motion to approve the proposed budget and the proposed fee schedule. We'll vote on both as one. Do I hear a motion to approve?
So moved. Rosemary.
Second, McDougal.
Thank you. It has been moved and properly seconded. I will entertain a roll call vote to approve the proposed budget.
Chairman Ireland,
Yes.
Vice Chair Jackson,
Yes.
Dr. Miller, Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Dr. Wright.
Yes.
Thank you all. The proposed budget has been approved, and Will and Rod will bring us any changes or edits that might come about between now and the time that the county's budget is finally approved. Moving on to item number 7 on the agenda, respond to entertain questions any board members might have with regard to the public health vacancy report, the public health NOV report, notice of violations, and the health director's report. Are there any questions, concerns regarding those 3 reports?
I have one question from the vacancy report. So if I remember right, I think the overall turnover rate was like 15% or something. But is there any way that we can pull out? I'd be interested in knowing what the vacancy rate is for our nursing staff. It does list the positions, but I wasn't smart enough to try to figure all that out.
I
Rod,
definitely
is
don't
that
want,
possible?
Yeah,
can,
and not right this minute, not right this minute. Just,
Okay.
Right.
yeah, just going forward.
thank you. I didn't want to fudge the numbers, but we'll be more than happy to get that to you. And definitely reach out to HR to make sure the numbers are accurate. But I would say that earlier on in the pandemic to the Board of Health, we did have our struggles with nurses kind of going on to greener pastures. But toward October, November, it kind of leveled off. But the summer months were not too kind to us. But I look forward to providing you with that information.
Okay. All right, thanks.
Thank you. Moving on to item 8 on the agenda, committee reports. I don't believe we have any committee reports. Am I correct?
No, except we had the finance committee meeting this evening.
Okay, very good. Very good. I'm sure you'll be bringing any information that you need to share with the board.
No,
too.
I'm talking about during this meeting, we just had it.
Oh, okay, very good. Thank you. Old business. Any old business that needs to be addressed by the board? Hearing none, we'll move to item 10, new business. Budget ratification. Rod?
Didn't we just do it?
This is money coming to the budget that needs to
Oh,
be approved to be added to the budget.
I do apologize for whatever reason the links are not able to pull up for me. So I will hope to work in tandem with Will to be able to explain what needs to be ratified. Oh, I'm sorry. Thank you so much, Rosalind. She just brought it in. The first one is COVID relief funds, particularly for mass vaccination and planning. That is $753,843. Once again, it's coming to us from the Women's and Children's Health Section Immunization Branch, and it's for the purpose of helping to support activities associated with COVID-19 mass vaccination planning and implementation. So this is definitely for your consideration. And the big money, if you will, is again coming from the North Carolina Department of Health and Human Services Division of Public Health Epidemiology and Communicable Disease in the amount of $2,574,826. And again, it's primarily for the purposes of COVID. And it is to allow us to do testing if necessary, increase our workforce, which is something that we definitely are doing through temp staffing. And then just to support our overall surveillance activities, expand informatics, and just do all the things that we need to do to continue to keep our residents safe through COVID. Mr. Chair, that is all I have for right now. I'm more than happy to entertain any questions you may have.
Anyone have any questions for Rod? Hearing none, we'll take these items individually. The first, the budget ratification. I'll entertain a motion to approve that budget ratification.
Vince Curtis, so moved.
Vicky, second.
Thank you. It's been moved and properly seconded to accept the budget ratification. Can I get a roll call vote, please?
Chairman Ireland,
Yes.
Vice Chair Jackson, Dr. Miller, Dr. Rosemary, did you say yes?
It's on mute.
You're on mute.
Oh, yes, I'm just yes and all, yes and yes, yes.
Thank you. Dr. Miller, Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Otto,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Dr. Wright.
Yes.
Thank you. The next is the budget amendment. I'd like to entertain a motion to approve the budget amendment that Rod just spoke to.
So moved.
Do I have a second?
Second,
Been moved and properly seconded. We'll entertain a roll call vote for the budget amendment.
Chairman Ireland,
Yes.
Vice Chair Jackson,
yes.
Dr. Miller, Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Otto,
Yes.
Mr. Miller. You're on mute, Josh.
Oh, yes, Mr. Brown.
Thank you. Commissioner Alam and Dr. Wright.
Yeah.
Very good. Thank you all. The next item for new business are agenda items for our June 2021 meeting. And those are those bulleted items that you see on the agenda. Do follow up for previously hospitalized COVID patients with adverse effects and COVID variants updates. Is there anything else that the board thinks needs to be an agenda item for our June meeting? Hearing none, we'll move on to item 11, informal discussion. Any informal discussion from any board member?
No, I just want to give a thank you and express tremendous gratitude for the Durham County Department of Health and its staff, led by Mr. Rod Jenkins. Y'all have been phenomenal. And the money keeps pouring in. I like to tell the Lincoln folk, when we get money, if you let your light so shine, then people will see, and
That's right.
That's right.
a way will be made. So congratulations. Thank you. Happy Public Health Week.
I will say, serving with you on the Lincoln board, that sounds awfully familiar to me.
Yep. I'm a one-trick pony.
Thank you for that, Dr. Jackson. Anybody else? Hearing none, the chair will entertain a motion to adjourn.
I move for adjournment.
All right. I second. That was
So,
great. I love efficiency.
Moved and properly seconded. Roll call vote to adjourn.
Chairman Ireland,
Yes.
Vice Chair Jackson,
Yes.
Dr. Miller, Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Dr. Wright.
Yes.
Outstanding. Thank you all for a great meeting. We'll see you in June.
Thank you to
Thank
the
you.
Board of Health.
Thank
Appreciate
you.
it.
Yeah.
Bye now.
Anything, just let me know.
We'll do it. Thank y'all so
All right.
much.
Oh, and
Thanks.
congratulations in the getting into the doctorate program.
Oh, wow.
Yay.
Thank you very much. We appreciate that.
Not a
Awesome.
problem. Proud of you.
Thank you so much.
Great.
All right.
Bye now.